Overrepresentation in the justice system, unemployment and poverty, limited options in terms of housing, jobs, education.
There's many other family members that have been severely impacted themselves on a personal level. They actually may have ended up having their own mental health issues.
Things are done to us rather than with us. We're not seen as experts of our own lives and often not even seen as competent to make decisions about our own treatment choices.
Well, having a mental health breakdown is a very humbling experience. I never thought in a million years that my former experiences would be seen as a form of expertise, and it's wonderful for that to be acknowledged and to be able to make a difference in the mental health sector and help other people.
Certainly in the AOD sector, there is an extremely well qualified workforce out there offering really good clinical sound judgments around alcohol and drug use issues. And it's my belief that the AOD sector works really well within evidence-based models. We've been fortunate to have had support from a peak body who's been able to develop a set of standards that have been able to be used for accreditation purposes.
So I think for many people in around the mental health sector, there is a lot of history around psychiatry, the medical model, the reputation and the labels associated with mental health. Who provides treatment are clearly different. We all have many things in common, like wanting to live a good life in the community, to have work, to have family. And our roles are similar because those are the goalposts, I guess, that we're both working towards. Good services, how to find the right balance, not to take over people's lives, to be helpful, and for every individual that's different. I guess in essence, we're both here doing the same thing.
That we both come from a very person-centred perspective, that we're not expecting someone to come in with one issue, that we're expecting a whole load of issues to be addressed when someone comes in. You know, this idea of compartmentalising people and chopping them up into pieces is not realistic. I would not like to think that people come to an agency and leave feeling hopeless because they've been told that they've got to go somewhere else for that and somewhere else for that.
I think both mental health and the alcohol and drug sector are under-resourced compared to some of the other services, and that includes research money, where you'll see significant amounts spent on cancer research and not so much in alcohol and drugs and mental health.
This isn't just about services, but also government policy and what government purchases.
I understand that often alcohol and other drugs can trigger mental illness.
I'm sure there are people that have AOD issues that don't have mental health issues, but my experience that most people have both issues, whether it's a diagnosed or an undiagnosed.
You know, there's a lot of things that come into play to get to a point where someone is acute.
I think there's a broad range of service providers in both sectors in terms of...
I think it's a fantastic opportunity to have services co-locate.
I think there is a lot of stigma attached to mental health problems. I believe there's even more stigma attached to alcohol and drug problems.
I think the difference is that the way of dealing with that, or the way of the treatment road, is quite different.
Certainly in the mental health sector, pharmacotherapy is a more commonly used tool than it is in the AOD sector.
Yes. Mental health, I think, is more seen as a health issue, whereas alcohol and drug is as a legal issue.
You know, a lot has been done in the consumer and carer movement to change attitudes. It helps to reduce stigma and discrimination where people see us through a different lens.
I think there's greater sympathy towards mental health consumers, where alcohol and drug consumers, they're often blamed for their situations and it's seen as a choice. Alcohol and drug sector is more likely to look at a mental health assessment compared to the mental health sector.
If there's no one willing to help them because of the state they're in, where do they go to from there?
Historically, the mental health sector comes very much from a medical model. Whilst the AOD sector very much sees itself as a specialist and clinical service.
We probably both come from different frameworks, I think.
So I think the commonality is that the person is the same person, but the other ways are treated very differently, and I think the recovery approach needs to be embraced by both sectors.
One of the major differences is the construction of the sectors, if you like. In mental health, I think probably the majority of the clinical medical services are provided by the government. Different. I would say the majority of the services that are provided to the alcohol and drug sector would be by the non-government, not-for-profit sector.
For our people with mental health issues, we don't want them to go to rock bottom, and I think it's really difficult to hear that. They would say, you just have to let him go. All we want is for him to have an independent, happy life. All we want is to be able to let him go. But he has a mental health issue, and he actually relies on us.
The language is very different in the mental health sector and in the AOD sector. The term recovery, which I think is a fairly controversial term, whilst it fits nice and generically in the mental health sector, I think there are some issues it may be a little bit of a bumpy track, I think, in the AOD sector.
There's a spectrum in everything.
I imagine we've both got more in common that we think of.
Going from one service to the other and finding it really difficult. What happens to those people?
So it's like when a client presents to the service, it's about getting that service into them. It's not about giving them the runaround and making them get out and look for it. It's about...
Are we reinforcing some of those negative medical, keeping people constrained, or are we alongside them, freeing them up from some of those things? And I imagine that's in both sectors. It's
where it's not everybody doing the same job. It's that some areas do require specialist support.
Like, what's the boundaries of what we can offer? And the goalpost is the same at the end, the notion of a good life and people getting their life back, if you like.
It's a wonderful opportunity for the sectors to work together to have better health outcomes for service users.
Again, I think the AOD sector has done extremely well in upskilling their staff around working with comorbidities. And, we've been fortunate in Australia to have had actual federal government support for this one, where the comorbidity projects have allowed us to all be upskilled to better manage some of the mental health issues that are presenting at AOD services. It's a shame that they didn't take the same opportunity to upskill the mental health sector around managing some of the AOD issues.
Treatment should also be holistic and address all needs, which may involve other agencies, partnerships, etc.
There does need to be a better understanding of the language and the issues and the jobs that each of us play.
Services stand in front of people and protect them. Sometimes they stand next to them. Sometimes we have to step back and trust that people will be okay.
It's legitimately my role to tackle both mental health and AOD issues, though, that they have the skill set and they are competent and capable and able to deal with it, and also that they have the confidence. So
I think there's an opportunity with the mental health sector and the alcohol and other drugs sector integrating that, for students and professionals where they had a degree where they could have a double major, because the sectors are quite linked, and I think it would add value and capacity.
Instead of AOD being an add-on into some of the university courses that we have, it should be intricately wound into it. The bottom line is it's about making our services more palatable and more user-friendly for our consumers.
There are probably wisdoms in both sectors we need to share and learn from one another.
We do need to work more effectively than we do together.
Some of these things we just can't do ourselves. We have to do it together. And so it's finding ground where we can work with other organisations for the better outcome for people, but keeping the person at the centre.